I'm very happy to have you here, Adele. Adeel. And it's too funny because yesterday I had someone asking how my name is pronounced, and he came up with a version I haven't heard yet. So, and I had a lot of versions. So,
Out of
sorry.
curiosity, what was the version?
No, because normally it's my name is Elir and
Yeah,
Elia, and they
a
said,
liar.
how,
Interesting.
how how do you came up with additional letters? But anyways, uh, I'm very happy that you're here. I would like to give you a short. I would like to give you the opportunity to have a short intro, and then we dive directly um, into your life.
Yeah, absolutely. Thank you, Alir, for having me. And so I'm Dr. Aadeel Akhtar. I'm the CEO and founder of PSYONIC. We develop advanced bionic limbs that are accessible for humans and robots.
That is a perfect pitch. I think it was everything in within less than 30 seconds. Um, I like that you have the hands with you. We come back later to the hand. First, I'm always interested in how was your upbringing? How was your education? Because I'm really trying to find the patterns that make a founder, that make someone who has this entrepreneurial spirit, but also the technical expertise to come up with something.
Yeah, so I was born in the Chicago suburbs in the 80s, and my I have two older brothers. My parents they came from Pakistan, so they were from Karachi in particular, and they moved I think to the U.S. back in like the 70s, like the and like 60s and 70s, and so youngest of three boys, and we all grew up in the Chicago suburbs, and for me to get into this space, I mean, this is something I've wanted to do my entire life. And when I was 7 years old, I was visiting Pakistan, visiting family there for one of the first times. And this was back in 1994. And that was actually the first time I met someone missing a limb. She was my age, missing her right leg and using a tree branch as a crutch. My family were visiting like just like the shops on the street. Like there was a bazaar, and she was just right around the corner, just asking for money and using like a tree branch as a crutch. And so, my brothers and I were like, we hadn't really seen anything like this before, having grown up in the U.S., right? But this girl, she had the same ethnic heritage as us, right? She was Pakistani, but she had such a vastly different quality of life. And this stuck with me. Just this image that, like, in the US, we have access to more resources than she would have in that particular situation. And these are resources like healthcare, safety, like financial resources and things like that. And so that's kind of what spurred my interest in wanting to build prosthetic limbs, particularly that were like accessible to people who couldn't afford them, right? So that kind of sparked. Go
So,
ahead.
sorry to interfere, but so you were born in the 80s, and then I think you said 1994.
Yep. So
Uh,
7 years old in 1994. Yeah, when I went to Pakistan.
but you said so. This was one of the first times where you encounter this kind of situations, or people with this kind of disabilities. And you said this stuck with you, right? But
Yeah.
I mean, until I think you mentioned that you have a doctor degree. Until there, there's a long path, right? So
Oh
maybe
yeah.
you can take us with that journey because I'm really interested how you carried on that kind of moment into your journey.
Yeah, and so the plan from there was to then become a medical doctor, right? A medical doctor who works with
Mm.
people with like limb differences and disabilities and things like that. And so I went to Loyola University Chicago for my undergraduate degree. I was a biology pre-med student, and it was my sophomore year of undergrad that I took my first computer science class, and I loved it. I loved everything about building my own programs and like writing
Mm.
code, and I realized that if I become a straight up medical doctor, I don't get to do any of the cool stuff that I was learning in my computer science classes. And so I was trying to find a way, like, how could I combine my interests in prosthetics with computer science and engineering? And right down the street from Loyola's downtown Chicago campus is a hospital. It used to be called the Rehabilitation Institute of Chicago, and now it's called the Shirley Ryan Ability Lab. It's like the number one rehabilitation hospital in the US for like, I don't know, like the last 38 years or something like that. And this was around 2007, 2008, that they had made some really big breakthroughs in these neurally controlled bionic limbs. And they had this surgery that they developed where they would take people who are missing their arms, and then the nerves that are in their body that remain, they would rewire them to other muscles that they still had. Like, for example, if you're missing your arm or your shoulder, they take those like four major nerves and then rewire them to your pecs, your chest muscles. And then what would happen is that when the patient thought about bending their elbow or making a fist, their chest muscles would now contract because their body's been rewired. And then you could use a muscle sensor then to pick up those signals and then control this like DARPA funded like $1 million bionic arm developed by Dean Kamen and the military and Johns Hopkins. And when I saw this, I was like, this is the perfect combination of engineering, of physical medicine rehabilitation, neurology, electrical engineering, mechanical engineering, computer science, all put together in one. And that became what I wanted to do. And one of the big things was that, the arms that they were using, they cost like hundreds of thousands to build. And so to make that really viable from a clinical standpoint, especially if we're trying to hit more marginalized populations, that cost is way too high.
Mm.
So that kind of shifted my thinking into being like, how can we develop prosthetic limbs that are more advanced than anything else, but then still low cost enough so that more people can access them. So I ended up finishing my bachelor's in biology. I got a master's in computer science at Loyola. I taught there for a couple of years, and then I joined the MD PhD program at the University of Illinois at Urbana-Champaign, where I got another master's in electrical and computer engineering, PhD in neuroscience. Then I left medical school to do this because this was a little bit more fun than finishing medical school. But we'll get back to that in a second. And while I was doing my PhD,
Oh, wait,
um,
wait. I need to
sorry, go
interfere
ahead.
here again because I think you're so excited about what you're doing now. You said that you have a bachelor in biotechnology and then you did a master in computer science.
Yes, biology and computer science. Yes.
Um, I mean, if you are able to find something that is leading from one to another, it might be easier. But especially when you're changing subjects or when you're going to different directions, um, these are the situations I'm interested in because uh, it's not easy. It's not easy because
Sure.
there's a lot of pressure that you put on yourself and maybe parents or friends that because you were telling them all the time, this is what I'm gonna do, this is what I'm gonna do, and then you change course, right? And so how was that for you? How was it? Was it, change of decision or was the storytelling so clear, was very obvious for everyone? So this is one leads to another, or was it hard to get from one point to the other one?
Oh no, it was not clear at all. And because again, the plan, what my parents wanted for me and my brothers were they wanted us all to be medical doctors, right?
Mm,
And so that was still part of the plan, but it changed in a sense that I was adding more onto it, right? So that's what the MD PhD program at like the University of Illinois was, right? You still get the MD. It would either be like originally I think I wanted to become a neurosurgeon where I was doing like these like complex neurosurgeries to connect
mm,
brains and nerves to electronics. And then, as we started developing more on the technological side, it scaled back a little bit on the medical side. And it was like, okay, maybe physical medicine rehabilitation would be a better choice because then I can still work with patients, like
mm,
a patient population of people with amputations and limb differences, but also then focus more on like the engineering side, which is I loved the engineering side of things, right? And um, and so I remember having a conversation with my parents when I was talking to them about this choice, and they were just like, "Why are you making things so hard for
mm,
yourself, right?" And because again, they just wanted me to become just a straight up MD, right? But the thing is that I really wanted to revolutionize this field, right? And in order to revolutionize the field, it wasn't enough to just become like an MD, right? We had to do a deeper dive into like all like what the technological capabilities are. I mean, especially like Moore's law was still going like pretty strong around that time too, right? So technology just kept getting cheaper, it kept getting like faster and smarter and with more processing power. And this, around like 2013, 2014, like Arduinos were already like huge at that point, or at least in the hobbyist communities, like everyone was using Arduinos to like start building whatever they wanted, right? So you could like put motors on it, lights, like just send like really simple code over C or Java, and they gave you like all these tutorials online on how to like build all of this stuff. And so I remember for one of my birthdays, my wife had gotten me an Arduino, and I was like, this is fantastic. And that's kind of like what really set me down that engineering path. So it's not just like building software, but now it's like writing firmware and like writing code for actual hardware and like building out like circuits and things like that. And so there was already kind of like a shift in that direction. And I really still wanted to figure out how can we merge like the medical side and the engineering side in particular. And so in going to the University of Illinois, it's kind of interesting because when I interviewed, I had applied for I think 13 schools, 13 MD PhD programs, and the only place I got an interview was actually the University of Illinois. And the University of Illinois is a family school for me. Both of my older brothers went there for undergrad. I've got like I think 14 cousins now that have gone there as well too. And it's one of the top engineering schools in the world, which is fantastic. So it really was able to cater to a lot of those like pursuits that I had. And when I had applied, I for that interview, I actually did not get into the MD PhD program. I got into the electrical engineering like graduate program as well as the neuroscience graduate program. And then I found out a couple months later that I also got into the medical school, but not the combined program. And what I ended up finding out was that the when I was doing my interviews, the deans of the medical school were like, I told them, I want to build prosthetic limbs. I want to do this. Like, I want to, like, I saw that girl in Pakistan when I was a kid. I want to go back there at some point and then like be able to fit devices in Pakistan. And the deans of the medical school were like, well, you can do that with just a medical degree. And then the engineering school people were just like, well, you can do that with just like a PhD in engineering. And so because of that, they were like, get one or the other. And I was like, huh, that's interesting. So I got into both programs, but not the combined program. The following year, I ended up like reapplying into the MD PhD program, and I got in properly. But it was just like a frustrating hurdle that we had to go through because it was just like why wouldn't I be in the program in the first place? So there was just it was a fight to go down that path. The
Mm,
path that I saw was the best way to do this work. At that point, it was clear in my head that this is the work that I wanted to do. What wasn't clear was what was the best path to get there, right?
mm,
And this is where it gets a little bit interesting as well too, because now the path was that like I would become I finished my MD PhD, I would work at an academic hospital, I would have my own lab at an academic hospital where I'd see patients like once a week clinically, where I'm their doctor, and then the rest of the week would be all research and development on like prosthetic limbs and like bionic limbs. And then in the summer of 2014, we got the chance to go down to Quito, Ecuador, and we were working with a nonprofit organization there called the Range of Motion Project. And the Range of Motion Project's mission is to provide prosthetic devices and rehabilitative care for those who can't afford them, primarily in Latin America. So Guatemala and Ecuador are their main bases. And their founder is an alum from the University of Illinois. That's how we got in touch. And uh, at this point, consumer 3D mark or 3D printing had become like it had boomed, right? Like 2013, 2014, like that's when MakerBot was coming out with like their first consumer 3D printers, and we got our first MakerBot like in our lab in the office, and we were like, we're engineers at one of the top schools. Why don't we try to 3D print our own like hands. And we started with some open source designs from InMove and like Open Bionics, like some really early designs there. And then we made our own designs that we open sourced ourselves. So like we call them Mark 3 through Mark 5, generations 3 through 5 of our hand, we open source. So you can find all the instructions online to build those. And we brought down Mark II of the ability hand to Ecuador. And so this is part of a much longer story of 2 weeks of all-nighters and trying to get this hand to work, right? This hand was 3 times the size of an average adult human hand, had wires going everywhere, plugging in breadboards, power supplies, the wall. And our patient, Juan, he had lost his left hand 35 years prior due to a landmine explosion. He was in the Ecuadorian army, and there was a border war between Ecuador and Peru. And in front of international news stations, he said he felt as though a part of him had come back. And that was because he made a pinch with his left hand for the first time in 35 years. He actually forgot how to make a pinch with his left hand, and we had to retrain his brain by placing a mirror in front of his left side, reflecting his right hand, tricking his brain into thinking that his left hand was there. And when he said that, that's when I realized if I stay in academia, this just ends up as a journal paper. If we want everyone to feel the same way that Juan did, we had to commercialize this technology. And that's when Psionic was born. And so this was a huge departure from like what my plan was going to be, like going to medical school and then getting a PhD in engineering and then like working at an academic hospital. Now we're talking about entrepreneurship, right? And and the thing is that we wanted to make the most impact that we could. And
Sorry, you said a few times we, and I mean, obviously, when you're in the lab and you're at the university, you're not on your own the majority of time. I mean, sometimes you are the majority on the times on your own, but I was curious that the people that you're surrounded with now in the companies, is there a lot of people that you know for a longer period of time that are being part of the journey for longer? Can you say something about this? Because this
yeah,
is about
absolutely.
finding the right people. So this is team building when you have a startup, when you're being a founder, and you're coming from academia, and then you, as you said, entering the entrepreneurial part. Maybe you can say something about this, the people that you met along the way, and that you're still, maybe not with you anymore.
Yeah, yeah. And so when we were, pre-Psionic, like the years leading up to that, like going up to this trip in Ecuador, I was in a lab. It was actually an aerospace engineering lab, which is funny because it's so interdisciplinary, right? I was a neuroscience PhD student in an aerospace engineering lab. So this was Professor Tim Brettel, and he came from Stanford and Caltech, doing like climbing robots for like JPL. And so robotics was kind of the thing that brought all of those disciplines together. It's so multidisciplinary that you've got like aerospace engineering to neuroscience to electrical engineering to mechanical engineering and everything in between, right? And so that was one of the coolest things about being in Professor Brettel's lab was that because things were so multidisciplinary, it was such a collaborative and fun environment where some people were working on like using EEG headsets to fly like mid-sized planes that we built in the lab itself, to like building like prosthetic limbs that are controlled from your muscles, to doing like elastic rod manipulation planning, to like highly theoretical like applied mathematics and all of that stuff in between. So the expertise we were finding, like the graduate students we were meeting, it was just this amazing set of individuals and diverse individuals that have all these different mindsets like coming together to solve a lot of like really cool problems. And so the one that I particularly wanted to go after was building bionic limbs that were affordable and accessible. And so I think at like its maximum, I had like 20 undergraduate students working with me at the time that I'd recruited in one way or another through like just like different programs that we were a part of through the university. Uh, and my one of my undergraduate students at the time, Jesse Kornman, he is our current director of R&D here at Psionic. So he's been with me since like before the company was even born. He was our very first employee that we hired and put on payroll. And he's developed, all of like the electronics for every single version of the hand since 2014. And It's been incredible getting to like, see him grow like over the years too, starting from like a sophomore in undergrad all the way to like, a multi-million-dollar company that has like hands on like 200 patients, over 200 patients across the US, and robotics researchers around the world, including NASA and Meta and Google and Aptronic and a bunch of other places. And so it's, when you look back on it, it's just so amazing to think about like where we've been at that time and what point we're at now.
Um, Something that I really like is that you're so enthusiastic about uh, yeah, the collaboration part. So what I see or what I have seen is that you have a lot of people that are fighting on their own, or not understanding that this is, I mean, it's obviously a competition, right? But even
Sure.
with being in a competition and have competitors, there's also a part that when you understand this and you're taking advantage of it, it gives you an advantage. So sharing and working together and collaborating. And yeah, you were mentioning that you were part of different kind of programs and that you were working very interdisciplinary.
Yep.
So I think
Yeah.
here this is something that maybe a few people are afraid of. I need to understand this topic very much, and there's two sides of it: being overwhelmed with the opportunities and things that you could do and things you want to do, and being part of other people's projects, but then pursuing your
Sure.
own project. I think one thing that I can see at you or in your story is that it seems like very early on you had a like end goal. It wasn't 100% clear, but it was somehow clear, and but the path was unclear. So that means that gives you some sort of guidance, but it gives you on the other side a lot of flexibility. That there's different paths, you meet different people, you see different opportunities along the way, and I think this is definitely something that people can learn from. That hearing this kind of podcast, that as long as you have a bigger vision, then there's always some side quests that you can encounter, and you will find some people along the way that maybe you will help building their dream, or you together will build your dream. So interesting. Thanks for sharing here. Coming back to 2014, making the transition because we were entering the entrepreneurial side of your life, right? You've been heavily involved in academia, and this is a recurring topic here. Get, this bridge from being in academia, then becoming an entrepreneur. How is that for you? How was that initiated or helped by? Was there some people or some books or videos or podcasts or what? What was there something or somebody who helped you make this transition? Or maybe you can
Yeah.
dive into that.
So fortunately, at the University of Illinois, they had like a center called the Technology Entrepreneurship Center. They have it's still there, and this being at a big engineering university, this wasn't their like the first time that they've helped engineers like commercialize technology or bring about startups. And they had their own like incubator on campus and everything. And so we went through basically all the programs that the university had to offer in like engineering entrepreneurship, basically.
Nice.
And so including our like school's business plan competition, like the National Science Foundation had a program called iCore where you go and do like what we call customer discovery, where you call as many potential end users as possible and figure out what their pain points are, and then that shapes what your like minimum viable product or your hypotheses are, on like what your product should be are actually going to be, and that was really extremely helpful. Just even going through that process alone, and we found out of many things on that process that especially along the front on the lines of we were 3D printing our hands at the time. And if you give someone a 3D printed hand, they're going to break this thing within like a couple minutes of using it, maybe an hour of using it. And we wanted to still leverage the low cost of 3D printing, but make this hand more resilient to anything else that's out there. And so on the latest version of the hand that I have right now, you can see that the fingers are compliant, right? I'm squeezing the fingers together and they're flexing out of the way, much like your own natural fingers would. So I can take it, I can smash it, and I've climbed the roof of my house. I've dropped it 30 feet in the air, 10 meters in the air, and it survived. I've put it in a dryer for 10 minutes. It survived that. I've stepped on it. We've done flaming board breaking with it. And this was all because when we actually figured out what our user needs were, we realized that robustness was the most important thing. And so instead of 3D printing the actual links and joints and components, we would actually 3D print a mold and then inject silicone and rubber, which are more compliant materials like your own natural skin is. And then we would use that to make the fingers instead. And so we could still leverage the low cost of 3D printing, but then we could make this hand more robust than anything else that's out there. And going through a lot of the processes that the university had, a lot of the programs that the university had for kind of translating from the engineering to the entrepreneurship side, that really helped us to kind of like hone in on those particular aspects. And, going back to one of the questions you were asking earlier too about, you know, how did like the kind of like the PhD like help, or like the academic side help with this? And I think one of the key things here was that we had a very, very strong understanding of what the state of the art is in the space. We know like what all the the researchers are doing across the world in terms of like implanted electrodes, like to read your nerves directly from your body, from your brain. On the robotics side, like where like the DARPA robotics challenge was happening and all the humanoids that were coming out, and we read all their research papers and we know exactly how they're doing things like SLAM and like deep learning and taking those aspects of it. And because of that, it's given us a keen eye into what the market is going to look like and where we should put in our efforts. So one example of that was that when our hand came out, it was the first hand commercially available to give users touch feedback. So we have touch sensors in the fingertips, the finger pads, and like the side. So there's 6 touch sensors in each finger. We can stream that over like Bluetooth or over like a USB connection. And for our human
You
users,
built them yourself?
yep. Yeah. So we built the sensors ourselves in house, and for our human users, when you touch it, they'll feel a vibration. If it's connected to their nerves, it'll feel like it's coming from their hand. For our robotics users, they can use that for manipulating objects to know like how hard they're pressing on an object, so that they can write some autonomous like user in the loop, or like just straight up autonomous robot to do things like use tools, like on the International Space Station, what NASA is doing, for example. And we had that foresight because we kind of went through that trajectory, right? And we also can kind of sniff out like BS a lot more easily as well too. Like if we see a paper come through and we're just like, they're claiming all these things, but like this would never be commercially viable. Like we can tell pretty quickly whether this is something that is probably worth pursuing on our end, or whether this would never actually work commercially, but it's great in a research paper. So those are particular things that the PhD helped with.
And so really an understanding about how research is being done. And you
Yeah.
could say not research, but market research
Yep.
and competition research, right? Because I see this with a lot of startups. They are so not full of themselves, because this is way too judgy, but they're so focused on the technology and their own capabilities that some people, as I said, I think before our talk here, before our recording, being on social media or on some forums, or going to meetups and having discussions with other people outside of your lab can open your eyes and can you bring in contact with things you weren't aware of, and
Yeah.
some things that are not coming from within, right? But that can be used as an accelerator, or can enable things, or where you see this is a missing piece that I need for my work. Something I was curious about is what you were talking about now, going through those programs, for example. How many people have you been back then? So is this still pre company building, company registering, or is that already in the making? And how many people have you been? So what is the founder team?
Yeah, yeah. So I'm the sole founder of the company. So it started when I was in graduate school. I did have an original co-founder, but he left very, very early on in the company to go to Stanford for graduate school. And then so basically I'd been doing it all myself since like the first year of the company. We incorporated back in 2015. And so then I started to grow the team since then. And basically, at our core for the first couple of years, there were maybe like three core people on the engineering side to just like build out some of that technology. And when we moved to San Diego, that was about 2.5 years ago. We had like I think maybe 11 full-time people when we were in Illinois, and then like maybe 15 interns, like student interns that were working with us temporarily. When we made the move to San Diego, seven of us full-time made the move. So there were seven of us 2.5 years ago. And now we've got about, I think, 31 or 32 full-time people here in San Diego over the last 2.5 years. And we're moving into a bigger space. Our biggest issue right now is we've got more demand than we can produce, so it's a good problem to have. And so we've got a new version of the hand that we're actually going to be releasing in a week. It's the new and improved ability hand, and it's primarily on the manufacturing side. We can really scale that up and make 5 times as many hands as we could before. But also, it's more robust internally. You can use it with like cell phones, so you can actually control it on like on a touch screen
Mm.
interface. And it's got better like pull strength, and so it's just more durable, more easy to manufacture, and then it's got some features that are going to be exciting for our users.
Normally, I ask these kind of questions way earlier in our discussions, but you were uh, so excited and you were able to drag me along with you. But you were mentioning brothers, and you were also mentioning your parents having kind of expectation towards you. Um, Maybe if we are not way too past that point, but I'm really trying to identify what are the characteristics in growing up. What is the kind of support system? What is the kind of environment that is helping you building this kind of yeah, patterns or not characteristics that are necessary for this kind of journey that you endured, because it's a long time, there's a
Yeah,
lot of distraction happening, there's a lot of pressure, there's a lot of competition, there's a lot of self-doubt maybe.
sure.
And I mean, you seem pretty confident in your ideas and your capabilities, but because now we are entering the, let's say, successful phase, right? Because
Sure.
this is what you show, this is what people see, this is easy, this is where we are. But to get to this point, it's a long journey that is very lonely. And if you don't mind, maybe you can, not too long, but maybe a few sentences about the upbringing, what you
Yeah.
think in your particular case, what you think was built back then that helped you today.
Yeah, I mean, my parents, they instilled like a lot of independence, like independent thinking and critical thinking in me and my brothers, like at a very young age. And they were my dad in particular is very regimented on like math and science, like making sure that they were always ahead of like the rest of the classes in math and science. And then my mom would focus on like the language side and like the arts. So we're all like bilingual. We can speak Urdu and read, write, and speak Urdu, in addition to like yeah, the math and science side of things as well. And so my older brother, so he now I think believes he's like a senior research scientist at Netflix, and he did his PhD at Stanford. And then my oldest brother, he got a degree in nuclear engineering from the University of Illinois. And then my older brother and I were both valedictorians in high school, so we were kind of high achieving on that front since the beginning. But honestly, my transition from high school to undergrad was a bit of a struggle. That was a big change for me, kind of like, living independently for the very first time. There's a lot less structure in college than there is in high school, and I was in a lot more advanced classes that were a lot harder for me than they were. So like my first couple of semesters were really hard, and I had to kind of like pick things up and like figure out like what is the best path to like kind of move forward, like how can I still achieve like things like going into this prosthetics field. and things like that. And as I mentioned too, like I applied to 13 schools for the MD PhD program, and I only got an interview at one. So it's been a challenge to get there. Even on the business side, I mean, like startups are roller coasters, right? I mean, that's so you're going to have your really high highs, but then your really low lows. And one of the things that I often mention too is that in the summer of 2017, we went to China. So this was me, Jesse, my director of R&D, my wife who was 6 months pregnant at the time, our 1.5-year-old son, and then like three other engineers, all in a small high rise in Shenzhen. And only one of us spoke Chinese, and it was not me, and it wasn't Jesse, and it wasn't like my family. So, and we were there for 2.5 months, and that's where we found like our motor and our gear manufacturers out there. But we tried to do an Indiegogo campaign. I had just finished my PhD. Jesse had just finished his undergrad degree. We're trying to figure out, can we make this, like, can we turn this into a full-time thing? And we're trying to raise like $150,000 on an Indiegogo crowdfunding campaign, and we raised $7,000. So not even close to the 150K. And so then we were like, Jesse, I think, was looking into grad schools, like, should he start like applying? And I was like, maybe I should finish medical school and just go back to the academic route. And that summer, we had applied for our first Small Business and Innovation and Research grant from the National Science Foundation, or SBIR grant. And we ended up finding out in December that we were going to be getting that grant. And so we had $200 left in our bank account in the last week of December. And then the following week, in the first week of January, we had $200,200 now in our bank account. And so we went literally from our lowest low to like, the company's done, we're bankrupt, to more money than we had ever seen before, like in the company. And
Awesome.
yeah, so startups are just like full of like stories like that, right? Where it's just like this roller coaster. And honestly, a lot of credit to my wife for being able to be my solid foundation as we went through all of these struggles. And I would not have been able to get where I am without her.
Nice to hear. There's a good reminder that there's barely any person who can make it on themselves by themselves, right? So we always, it might be a colleague, might be parent, sister, brother, a cousin, or maybe a neighbor or friend. It's good. It's good that you say this because it shows that it is good to rely on people. I mean, every now and then you get burned, but if you don't have the capability of trust, right? Why should you continue? And I think this is definitely something
Yeah.
that a lot of people need to figure out. Coming back to what you guys are doing today, you were mentioning that you are now looking for something bigger, or you just moved into something bigger.
Yeah, so we just we're moving into a new facility that's 4.5 times bigger than our current one. So yeah, so the stuff that we're gonna have there coming out is going to be really, really exciting. Some additional limbs on the horizon, as well too, as well as so a lot of things that we're working on, like the invasive front on the human side, so direct neural recording and things like that too. So yeah, the future is going to be very exciting.
I think the last time that when we spoke, we were talking about humanoids and how this will influence your business, right? So you started with the idea in helping people um, getting new limbs and making their life easier, more accessible, as you said, and more affordable. And now we're entering a totally new market with players that are building humanoid robots. And I think there's not one week going by where we have a new announcement, mainly Chinese companies, but a few US and European players. So how did this transform your business? Because we know a few players that are very proud of developing everything on their own, but maybe you can give us some insights here.
Yeah, this was really interesting too, because uh we again, coming from academia, this was another advantage too, is that we knew I was in a robotics lab, so I knew what like researchers were looking for on the robotics side as well too. And so we had an API that we made, that programming interface, so that roboticists could actually program our hand as well too. And I was in Atlanta for a conference. It was like a prosthetics conference, and so at Georgia Tech was a professor, Seth Hutchinson, who used to be at the University of Illinois, and he was running the Robotics Institute there. And I was giving a talk at the Robotics Institute, and he was mentioning to me that you should consider going to ICRA, which is the International Conference on Robotics and Automation. And he was like, because if you bring your hand there, I guarantee you that every assistant professor in the nation is going to want your hand. And he wasn't wrong. And when we decided to go to ICRA, and we had a booth there, and it was just nuts. That just opened up this entirely new market. And what we realized was that if you're building a robot to do human tasks, we've optimized our hand for humans to do human tasks. So it makes sense that the robots use the same thing. And this was really exemplified when we went to NASA. So NASA has our hand on their humanoid astronaut robot Valkyrie. And we went down there, and we actually have three of our human users on staff in the company. So 10% of our company is actually like people who use our hand. And well, one of them, Annika, she is our user experience specialist, and so she was at NASA with us. And they were struggling to do this zipper that was on a panel that you'd find on the International Space Station. And so Annika, she goes up to and she easily does the zipper with her ability hand. And the NASA engineers were like, we didn't even think about using the hand in that particular way. And so we've just found that there's this symbiotic relationship. Like the robots can learn from what our human users are doing because they're using the same hand. And the advancements that we make on the human side are actually beneficial for the robot side, like in terms of robustness and dexterity and like touch feedback, and vice versa. The advancements that we make on the robotic side are help the human side as well too. And so I think the robotic side has exploded, like you've said, and it's basically like I would say 95% of our hands that go out the door are going on robots now. And because the volumes are so high, that will eventually bring the costs even lower on the human side to a point where even Medicaid or people would be able to pay out of pocket to buy the hand.
So are you able to disclose how much is a hand?
Yeah, so currently it is between 15K to 20K for a hand, and that's covered by insurance. So Medicare in the US will actually cover that for human users, and then yeah, for our robotics users, then it's cheaper than a lot of alternatives.
And as you said, the demand is higher than the supply, which means
Yes.
not necessarily, but is a very good indicator in product market fit. Uh, do you think you will expand on other limbs as well?
Yeah, yeah. So we're definitely in very early stages at looking at things like a wrist and an elbow as well as a knee and an ankle too. And who knows? Maybe at that point we've got all the limbs. Then we just add a torso and a head, maybe. But we'll see. We'll see when the time gets there. But one of our goals, though, is that we want to make a leg that a human user could do a triathlon in, so that they'd be able to run, bike, and swim with it, and be directly connected to their bones, directly powered by their nerves as well, and controlled by their nerves. So that's definitely in the pipeline. It's more so a matter of like how that's going to fit with like timelines in the market.
As we're coming towards the end of the podcast episode, I mean, it seems like a cliche question, but I think it is very valuable with the intention of this podcast is if you would have the opportunity to talk to your younger self at any given point, right? It could be the transition from biology to computer science, but could be in staying in academia and having $200 on your bank account. But maybe in the moment where you talk to your parents and having this kind of discussion, should I be an MD, MD, or should I do something else? Uh, is there something in particular that you sometimes thinking of it, like you do whatever you do, and then this thought comes up to your mind, and you this I wish I've known this much earlier in my career, or at this specific point where I had this kind of trouble. Is there something you would give it an advice to a younger self?
You know, I think one of the things I would probably tell my younger self is that it's it's okay for people to move on. and to let people go.
Mm.
And I think that that's all that had always been a struggle, especially like in the earlier days. Just because you're finding people that, complement your skill sets, right? So I don't have a degree in mechanical engineering, for example, right? So like we've always had mechanical engineers work with us, but then you get like really embedded with like certain mechanical engineers who are going to do things in a certain way, but then they end up moving on, right? And then you're like, can this even function anymore, right? And I think that so the answer to that question is like yes, obviously, because we did it. But if I kind of knew at an earlier time that that it would not be as hard as I was thinking to find the talent to do the things that we want to do, that would have been a lot less headache, I feel, earlier on. So in building the team, like I not underestimate the ability to build like a team that can do the things that the vision that and execute on the vision that I wanted to have.
I mean, being able to execute the vision. This is definitely something I take with because I think this is applicable. Yeah, you can apply this to every single startup out there. And
Sure.
I've seen a few startups myself now, and I see that having a vision is one thing, but executing is a total different game, and not everyone is good at both. Thanks for taking the time. I'm very curious to to see where you guys are heading. I think we both were at the Humanoid Summit in San Francisco early December, but I think we missed. Sorry. And there's a few more conferences upcoming, so I hope that I will see you in person. And
Yeah, we'll be at the Robot Summit and we'll probably be at the Humanoid Summit in San Francisco again towards the end of the year. So
nice, nice. It was a pleasure. I wish you much success, and yeah, looking to hear more news. You said something is happening next week.
yeah, so we'll be officially announcing our new and improved ability hand. So we'll have some fun videos to that we'll be releasing with that too.
I'm looking forward to have a look at them. Take care. Your day is about to begin. My day is about to end. Thank you very much for taking the time and sharing the insights and also sharing your struggles because I think people, if they listen, can definitely learn from them.
Thank you for having me.
Take care. Bye
Bye.
bye.